Parliamentary Secretary. I call the member for Murray.
Madam Speaker, today I'd like to talk about healthcare in the third world. I've recently returned from a desperate part of the planet where the sick, the injured and the dying can't access basic health services. It's a place where a woman had to drive 3 hours after being raped because nobody in her local hospital was able to administer a rape kit, where an old man who broke his finger had to travel 2 hours to get the bones set and then was forced to make his own way home, where a teenager who attempted suicide on a Saturday was told to wait until Monday for treatment because there's no services available on the weekend. In maternity wards, new mothers are turfed out of their beds 48 hours after caesarean births and 24 hours after normal births due to budget cutbacks. Even the dead can't escape government neglect in this area. The recently deceased have to be transported more than 8 hours to get an autopsy done, while grieving relatives wait up to 6 weeks to hold their funeral. This part of the world is called the Murray Electorate, a regional area of more than 100,000 people, but there are similar stories across regional New South Wales. Good, hard-working people in the towns of Griffith, Leeton, Deniliquin, Finley, Wentworth, Hay, Hillston and Moama are all suffering due to declining health care. Successive governments have gutted regional public hospital services during a period when we've needed more than ever, during times of drought, dreadful water mismanagement, industry closures and growing rates of drug addiction and depression. Lack of money is not the problem in one of the richest and most prosperous countries in the world. Indeed, this government keeps bragging about its huge surplus, thanks to all the taxes we're paying and the sale of our hard-earned assets. They even tell us spending on health is increasing in real terms. Sadly, the extra money has lined the pockets of bureaucrats, propped up private healthcare facilities and been sucked into big city services, all at our expense. Waste, mismanagement, a fetish for privatisation and devaluing of human life beyond the Blue Mountains have brought us to our knees. The government loves its private hospitals and wants to see them even in low population towns where a market barely exists. In Griffith, government strips the public hospital of its services and equipment and gives them to the nearby private hospital to keep it profitable. Public health care ought to be the first priority in a first world country, but it's merely an afterthought in much of the state. 20 years ago, we were promised services to fix broken bones in Griffith Base Hospital. Today, we're still waiting. I've asked the Health Minister for timelines on much-needed upgrades to the Deniliquin, Leeton and Griffith hospitals. No response. It's not a priority. What irks the people of Murray is watching how fast government can act when their corporate donors want something done. The unthinkable happened recently in far west New South Wales when the government scoped, planned and built and fully completed a massive $500 million rural project in just over 2 years. The National Party told us the 270-kilometre Broken Hill pipeline was needed to provide drinking water to Broken Hill, but they kept the business case secret, and we've just found out that the pipeline was all about protecting water for their corporate mates in the Northern Basin. Today I'm calling on the government to treat a sick child in Deniliquin with the same level of urgency they give to wealthy water traders in Sydney. I realise there are many challenges when it comes to rural health. It's not something that we can fix overnight. During the election campaign, my party, the SFF, devised a 10-point plan to address the rural healthcare crisis after talking to regional doctors and health staff. Incentive packages to attract doctors, streamlining registration processes, bringing back local boards, establishing a fund for regional hospital equipment, boosting patient transport services, ceasing all public hospital privatisation plans and conducting an inquiry into bullying are some of the steps that will take us in the right direction. I'm happy to work with anyone in Parliament, regardless of the party, to devise a rescue plan for regional healthcare. Let's get our priorities right and make the health and safety of our regional families our concern as number one. Thank you.